Okay, we're back from the break. Thank you for tuning in tonight. I'm your host, Dr. Michael Reiner, and we're kind of continuing a conversation regarding high blood pressure and its treatments. And we were talking about loop diuretics and non-loop diuretics. And we mentioned a few of those products. One you're probably familiar with is furosemide or Lasix. I see a lot of patients on that particular diuretic. And one of the mistakes I commonly see with regard to its treatment is that Lasix is usually given once a day. Well, in reality, Lasix is really a twice-a-day antibiotic. Once-a-day Lasix is the work of the devil. And if you don't understand what work of the devil is that means it's never done. You complete it and then you start all over again, kind of painting the Golden Gate Bridge. So with that being said, if you're taking once a day Lasix, you really should be taking it twice a day. We're going to interrupt that thought for just a minute. Ray is on the phone. Ray, are you there?
Yes, I am, Doc. How are you doing tonight?
Oh, I'm good. How are you, sir?
Okay, Michael Roos said hi. I just want to let you know.
Okay, great. Thank you.
All right. I have a couple questions. First of all, I want to let you know I called the legislature today, and they are proposing a bill to for the recreational use of marijuana.
Okay.
So it is in the legislature for your, I just figured I'd let you know. My two questions are, my blood pressure is 138/84, and I need to know if that's acceptable or if it's too high. And the second question, when I get a toothache, sometimes I get an earache that follows it. And then when I brush that tooth, the earache goes away. Does pain travel like that and cause something else to happen, like from a tooth? If you could answer those questions, I'd appreciate it, sir.
Oh, I'd be happy to, and thank you for your call. Let's start in the reverse option, the idea of tooth pain. One of the things that's very common in medicine is called referred pain, and that's why when you have chest pain, you feel it in your left arm, and that's because when we are embryos, we all start in a neural tube, and the organs actually pull away from that tube into its different areas. So when our heart is formed, it's pulling away from the left side, so therefore the pain is often referred from that particular area. The same is true with your throat, in that it actually pulls down from the ear. So anything in your neck and jaw could radiate to your ear. So it's called referred otalgia, or referred pain in your ear. And it's, I see it a lot of times. People come in with an earache, and I'll end up looking in their ear and it looks fine, and then I look in their throat and I see the reason they're having an ear pain. So a lot of people with sore throats will feel it in their ear. One of the common diseases associated with that is called carotidynia, or pain in the carotid artery. And a lot of patients will present with pain in the ear, and you actually take your hand and you put it up in the carotid artery, and it's tender, and that pain will shoot to the ear. And that's because the pain is now radiating along the carotid distribution, which is the internal carotid artery, passes right by your middle ear. And if you're quiet, a lot of times you'll hear this high-pitched humming sound, and that is actually blood that's being passed right by the part of the middle ear. We have two forms of hearing. We have air conduction and bone conduction. So when it's quiet outside and we don't have any noise to mask the bone conduction, we can actually hear the blood humming in our ear. It's a very high-pitched humming sound. For some people, it's really annoying, and they have to have on music or outside noise, or they won't be able to sleep. So I know that's more than you asked with regarding to that particular problem. And you did make a mention of the marijuana issue and the recreational. I know every state is going to probably entertain that law. I had a discussion with a patient today who brought the medical marijuana form, and I had some different views on it, but as I see people using marijuana for more of a recreational use, I tend to disagree with that to some degree. I mean, you are free to do just about anything that you want to do, but I do believe that not being a medicinal use lends itself to more accidents, more things of that nature, and a loss of control. I mean, I know alcohol is the same argument, but I think that I think it's a dangerous area for me personally to think about the recreational use of marijuana, and I think Colorado is thinking twice about about that particular issue, and I think it's caused them a lot of difficulties. Although I was looking at some of the statistics regarding the amount of students that were enrolling in colleges out there, and that's really sad. I mean, if you're going to spend that kind of money for an education just to go to a state where you can smoke marijuana, one of the things I know it really does do is it does interfere with short-term memory. With that being said, here you are trying to go to school to learn and to educate yourself, and you're, using marijuana, and that particular thing probably would interfere with your ability to retain certain materials that you need to do to be able to study and have good grades and pass the tests that you are partaking in. Not to mention the mixing of medications. One of the things I do in my office with regards to cannabis use is that I do believe that from a medicinal standpoint it is very useful with pain, it is very useful with appetite. I know people that use oils, I know people that use other products to get relief from arthritis. You're never going to find a study, evidence-based medicine on the use of marijuana, and that is because the government would never sanction or promote a study. They still consider it a narcotic, as a Schedule 1 or 2. They basically don't acknowledge its use, so therefore who's going to do a study and a controlled study with regards to marijuana and cancer prevention, or marijuana and arthritis treatment? Maybe down the road it might, but nobody's doing those studies. So everything that you're doing with marijuana medicinally is from the Journal of Irreproducible Results. It has no basis in what you were trying to accomplish. Meaning you can't take a control group and use marijuana and then take a non-controlled group and somehow, switch them out. You'll never get that kind of data. So therefore, as far as it becoming in vogue for, some type of treatment, I don't think that data will ever be there, and it'll just be a fringe treatment. Whatever works for Sally because she used it may not work for Jane and may not work for you. But I don't believe that I would want to stand in the way of anybody using marijuana for medicinal uses. I think it has a lot of good uses, but I think that if you're going to use it, just like any opioid or any medication, that you use it responsibly, that you be aware of its effects on your driving, your judgment, and all of the other things that it can impair. It's just one of those things that still needs a lot of work. So we'll see what the experiment is in Colorado. We'll see what the experiment and the jury has to say with regards to the use of that particular product and where it's going to go. Who knows? We're going to be taking a break here pretty soon, and one of the things I wanted to, I think I was talking about Lasix and the work of the devil, and I really don't want to start that particular talk because we're going to be break. I know the show is kind of just altered a little bit, but regards to that, a 4-hour medication is basically one of those particular medications that if you take it in the morning and you excrete all the salt and water with regard to that, then basically what's going to happen is you're going to spend all day reabsorbing that particular substance. So that's why it's not a good drug in that particular thing, but it's very heavily used. And, along that line, Ray, you asked about blood pressure and blood pressure control and what that particular number was. And all I can say is that it used to be we wanted people to be in the 120 to 130 range. If you're over the age of 60 to 65, those numbers have changed. And they have reset those mechanisms. So we're going to go to break, and when we come back, I'll tell you what the new standards are. Thank you for tuning in tonight.